Most people think mumps is just a childhood illness with swollen cheeks. But here's what is often not talked about. Mumps can affect the brain, cause hearing loss, and in some cases, infertility. And yes, it still spreads today, even in vaccinated communities. So if you think mum is no big deal, this video might change how you see it. Hi Healthy Buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will talk about various health topics. And today we will talk about mumps. Not just what it is, but what people often underestimate about it. This is part 3 of our series on MMR vaccine preventable diseases. We have covered measles and rubella in the previous videos. Let's start with a common belief.
Mum is mouth, and everyone gets it as a kid.
The reality is different and in some ways more concerning. So, what is mumps? Mumps is a common but highly contagious childhood viral infection caused by the mumps virus or paramyxovirus that primarily affect the salivary glands, especially the parotid glands near your jaw. But it can affect many different glands as well as the brain with serious complications. It spreads through respiratory droplets like coughing, sneezing, and through the saliva of an infected person. For example, by sharing food and drinks. It can be spread by contact with contaminated items and surface too. What makes it particularly contagious is this. Patients can spread the virus before they even realize that they are sick. If that surprises you, keep watching because this is where many people underestimate the risk. Not everyone gets the classic chipmunk cheeks. Early symptoms can be subtle, not specific, like fever, fatigue, headache, muscle aches, and loss of appetite. Then comes the hallmark swelling of the salivary glands. Then the parotitis that is bilateral in 2/3 of patients about 1 to 7 days later, which can make talking, chewing, or swallowing painful. These symptoms usually appear 2 to 3 weeks after exposure, ranges from 7 to 23 days. So it's easy to miss where the infection came from. Swelling resolves within a week. Submaxillary and sublingual glands are involved less often. Most people recover, but not all cases are straightforward. Here's the part that often gets overlooked. It is not the cheek swellings that concern doctors the most. It's the other manifestations. After parotitis, orchitis or testicular inflammation is the most common manifestation among adult males, occurring in about 1/5 of cases. The testes are painful, tender, and enlarged. Atrophy can develop in half of the affected men. Orchitis is bilateral in less than 15% of cases, which in rare cases may cause infertility. In women, ovaries or inflammation of the ovary can occur, but does not lead to sterility. Meningitis affecting the lining of the brain marked by cerebrospinal fluid pleocytosis can occur in half of mumps cases, but clinical meningitis is evident in only 5 to 25%. The disease is self-limited. Cranial nerve palsies occasionally lead to permanent sequelae, particularly deafness. This permanent hearing loss, which although rare, is one of the most concerning complications of mumps. These are not the typical outcome, but they are established risks. And this is exactly why prevention matters more than people think. The MMR vaccine has dramatically reduced mumps cases worldwide. Protection is strong, but not perfect. That is why outbreaks can still occur, especially in close contact settings like schools, universities, or military camps. The key difference is this: vaccinated individuals who get mumps tend to have milder symptoms and fewer complications. So, vaccination doesn't just reduce our risk of infection, it reduces the severity if we do get it. I know some people worry about vaccination because they don't know what is in it. Some people worry about the side effects. So let me tell you about it now. Mumps vaccine is made with live attenuated mumps virus, just like measles and rubella vaccines. The virus in the vaccine is alive but weakened, so it is able to activate our immune system to produce memory cells without causing full-blown immune response in healthy individuals. This kind of vaccine offers strong protection, often lasts for life, but not recommended for people with weak or compromised immune system. Because it is made from live attenuated virus, the risks of this vaccine are much rarer, significantly lower, and far easier to control compared to those posed by the wild virus. From medical standpoint, vaccination provides a much safer way to build immunity. For mumps, this does not just reduce your chances of infection. It reduces the likelihood of complications that can have lasting effects. You might hear people say,
I had mumps before and I was fine.
and that may be true for them. But medicine is about probabilities, not guarantees. We cannot predict who will develop complications. It's just like playing the Russian roulette. And vaccination provides a safer, controlled way to build immunity. It is concerning that some people prefer wild, natural way of getting immunity because they think that natural equals to safety. It is not. In terms of mumps, measles, and rubella, that cannot be further from the truth. These weakened viruses in the MMR vaccine are much safer than their wild counterparts, just like fire in the fire drill is much safer than the wildfire. That is my sharing today about mumps. It is not just a harmless childhood illness. It is a contagious viral infection with real, though uncommon, complications. The good news is that we have an effective way to reduce both risk and severity: vaccination. If you want to better understand how to protect yourself and your family, watch the full MMR series. The links are below. And subscribe for more evidence-based health contents, because informed decisions start with accurate information. I hope you found this information useful and can be a blessing. If you have any health-related questions or topics you want me to cover in future videos, please type in the comment section below. But please do not consult your personal health matters here. This is my disclaimer. Thank you for watching and see you in the next videos. Stay healthy and happy.